Welcome to the annual NAEMT faculty meeting. We appreciate everyone taking the time to join us today. We will be turning the meeting over to NAEMT Education Committee Chair Rick Ellis shortly, but first we have some brief announcements. First, NAEMT would like to recognize our sponsors for today's meeting. On behalf of NAEMT, we extend a warm thank you to the Public Safety Group, a division of Jones and Bartlett Learning, and GEMS, the Journal of Emergency Medical Services. We thank PSG and GEMS for their continued support in advancing the EMS profession. It is NAEMT's pleasure to turn the meeting over to Rick Ellis, Chair of the NAEMT Education Committee.
Welcome, NAEMT faculty, to the 2020 NAEMT faculty meeting. For as long as I can remember, NAEMT has been holding faculty meetings as part of its annual meeting. But this is the first time we have had to conduct this meeting on a live virtual platform. We truly miss not being able to meet with you and network with our EMS colleagues. However, we realize that holding our annual faculty meeting virtually has allowed many more of our faculty to participate. A record number of 763 faculty members from around the world have registered to attend today's meeting. Thank you for taking time to attend and learn the latest updates on all aspects of NAEMT education. Around the world, in large urban areas as well as small rural communities, EMS practitioners have been serving on the front lines of the global war against the COVID-19 pandemic, oftentimes without the necessary supplies and equipment to ensure the safety of their patients and themselves. This public health crisis is affecting every facet of our lives and has certainly impacted how we provide education to EMS practitioners and other pre-hospital providers. We recognize the unprecedented challenges that you and your training centers have been contending with over the last several months. Our thoughts and prayers go out to those members of our faculty who are practicing paramedics, EMTs, physicians, and nurses serving on the front lines of this global pandemic, as well as to those of you whose livelihoods have been impacted. Tragically, some of our colleagues have died of COVID-19 in their efforts to care for their patients. Let's take time for a moment of silence in honor of our colleagues who made the ultimate sacrifice for their patients during the pandemic. Thank you. Despite these challenges, we are moving forward. NAEMT faculty leaders have continued to develop new and revised course materials and support the establishment of new training centers and new faculty. Many of our training centers and faculty have implemented innovative approaches to ensure that their students receive complete continuing education. They have found cost-effective approaches to delivering this education in both high and low fidelity environments. They have adapted traditional classroom content for a virtual environment, using virtual breakout rooms to build and reinforce students' critical thinking skills, incorporating safeguards into traditional classrooms, including the use of masks, gloves, and face shields when conducting skills practice and patient simulations, and using online tools to assist with proctoring exams. We applaud our tremendous faculty for their work to weather this storm and continue their commitment to provide high-quality education to their EMS students. Now I'm very proud to introduce our team of NAEMT education leaders who have continued to work on your behalf throughout this pandemic. These faculty leaders have been volunteering their time to develop new and revised course materials, recommend policies to help our training centers, faculty, and students, train and monitor new instructors, and help establish new NAEMT training centers. We are deeply grateful for their contributions. First, I would like to recognize and thank the members of NAEMT's Education Committee. As soon as COVID-19 was declared a global pandemic, they jumped in to recommend policy adjustments to provide our training centers some leeway in conducting courses virtually. They also recommended that NEMT offer free webinars to our faculty to help them teach on a virtual platform. Webinars were held on April 18th and August 6th. Both were recorded and are available for viewing on the NEMT website under the Events tab. Next are Regional European Education Committee members. They have continued to assist NAEMT in reviewing training center applications, preparing new training centers and instructors to conduct NAEMT courses, and helping NAEMT address training center or faculty issues within the region. Our Regional Latin American Education Committee members. They have been promoting NAEMT courses throughout the region and organizing and conducting virtual courses. The Canadian Provincial Education Committee members. The Advanced Medical Life Support Committee members who continue to complete the AMLS 3rd edition components. Our Emergency Pediatric Care Committee members who are hard at work completing the content for the 4th edition of EPC. The Pre-Hospital Trauma Committee members who this year completed the new Tech Leo course and developed a tremendous World Trauma Symposium program. Our current author teams, Community Paramedicine, Critical Care Test Prep, and First on Scene. These authors are working on courses for NEMT that will be published starting later this year. Our regional education coordinators in the US, Mexico, and Colombia, and our national education coordinators in countries around the world. NEMT is thankful for all our regional and national education coordinators who help support new training centers and faculty worldwide. And our US state education coordinators. Thank you. NAEMT thanks all of our education leaders for their tremendous support of NAEMT education. We are very grateful for your efforts, particularly as we navigate our way through this pandemic. Now it's my pleasure to introduce Nancy Hoffman, NAEMT's Education Publishing Director, who will provide you with an update on the development of course revisions and new courses.
Thank you, Rick, and good morning, everybody. I have many great updates to share with you, as NAEMT instructors and committee members have been hard at work this year to produce quality content for a number of courses. To start, as many of you know, the 3rd edition of the AMLS Instructor Toolkit and new course manual published in English in April. For anyone who was unable to attend the live instructor update in New Orleans last year, the online AMLS instructor update is available through our publishing partners at PSG. The AMLS committee continued to work on derivative courses and content. For the 3rd edition, AMLS refresher is complete and is now in medical review. The online content for the hybrid version of the 3rd edition course is also complete and is in production with PSG. NAEMT recently sent a survey to faculty who taught AMLS Basics to obtain feedback on the AMLS Basics course. The survey results will help inform the committee about the appropriate length and format for the 3rd edition Basics course. Finally, the committee recommended a series of clinical webinars based on AMLS 3rd edition textbook chapters. The first webinar on pre-hospital shock was held on August 26th. Additional webinars are scheduled for the end of this month and October on pharmacology and sepsis. The EPC committee completed development of the 4th edition instructor toolkit, which contains new and revised lessons and patient simulations. This toolkit is now in production. A new student course manual is in development and will be published along with the ITK. The 4th edition of EPC will continue to use the American Academy of Pediatrics PEP textbook for in-depth, evidence-based content on pediatric medicine. A new 8-hour EPC refresher course is in development, and creation of a 4th edition hybrid course is soon to be underway. A 4th edition EPC instructor update is due to be released this fall. NAEMT has engaged in ongoing discussions with the AAP leadership about ways in which NAEMT and AAP can collaborate to support quality EMS pediatric education, both domestically and around the globe. The Pre-Hospital Trauma Committee completed development of the 9th edition PHTLS optional lessons. These 8 new lessons provide PHTLS faculty with the tools to tailor PHTLS course content to the needs of their students. The most recent optional lesson, Point of Care Ultrasound, was added to the PHTLS 9th edition ITK in August. The committee was excited to release the first ever validated PHTLS written assessment. Thank you to all the PHTLS faculty who participated in the pilot tests for that assessment. The committee is now working with FISDAP to finalize the first validated tactical emergency casualty care written assessment. Again, thank you to all the faculty who participated with those pilot tests. The new Tech Leo course was finalized and released this spring. Development of a new 8-hour tech refresher course was completed and is now in production. The PhD committee also developed the 9th annual and first virtual World Trauma Symposium, which was held on Monday and Tuesday of this week. We have a great team of critical care paramedics and educators working on a critical care test prep course. This week on Monday and Tuesday, the author team held the first virtual 16-hour NAEMT course to prepare paramedics to take the IBSC flight paramedic or critical care paramedic certification exams. IBSC now provides all NAEMT members with a $100 discount for any IBSC exam. Thank you, IBSC. Final course materials for the critical care test prep course will move into production and will be available at the end of this year. Current certified flight or critical care paramedics will be eligible to teach the course. The monitoring requirement will be waived for current flight or critical care paramedic instructors. The community paramedicine author team has been working on development of a curriculum to prepare paramedics for roles in community paramedicine and to successfully take the IBSC Community Paramedic Certification exam. NAEMT will offer the components of this curriculum as standalone course modules. The first modules, motivational interviewing, nutrition, and cardiovascular conditions, are now in production and will be released this fall. Instructor eligibility for these courses will be those who are licensed at the paramedic level or above, and either a current KHAP accredited paramedic program instructor, AMLS instructor, or IBSC certified community paramedic. NAEMT, in collaboration with the International Association of Fire Chiefs, created a new course called First on the Scene. This course is designed to teach the general public basic emergency response to life-threatening emergencies until EMS arrives on the scene. General topics covered in the course include activating the 911 system, hands-only CPR and AED use, administering naloxone, administering epinephrine, responding to life-threatening bleeding, managing penetrating chest trauma, moving patients to safety, and positioning injured patients. The course content is complete and is currently in production. To keep our education content up to date and aligned with evidence-based medicine, it is time to revise and update 3 of our courses: GEMS, EMS Safety, and All Hazards Disaster Response. To prepare for these revisions, NAEMT sent surveys to students and faculty for each course. Feedback from these surveys will be critical in developing revised course schedules and content. We are now in the process of identifying the author team who will revise the GEMS course, and we'll be doing the same for EMS Safety and the All Hazards course in the next couple of months. NAEMT has created a series of affordable refresher courses that can be taught virtually by our training centers. Excuse me. This set is the first in a series of new refreshers that NAEMT is developing. This first series can be taught virtually to respond to the decision by NREMT to allow all distance education for the 2021 recertification cycle. These refreshers will cover all of the national NCCP requirements: 30 hours for paramedics, 25 hours for advanced EMTs, and 20 hours for EMTs. And the good news is that CAPC has now approved these 3 refresher courses. An outstanding group of NAEMT state and regional coordinators worked very hard to develop this first refresher series incorporating NAEMT course lessons, and we thank them for that hard work. We know many of you may have questions about NAEMT education, and we will take participant questions about that right after our next presentation. But now it's my pleasure to turn the program over to Pam Lane, who will provide an update on NAEMT course administration.
Thanks, Nancy. And I just want to extend my deepest thanks to the members of the Education Committee who have worked tirelessly this year to review all of our policies and provide guidance to our training centers and faculty to help them navigate this pandemic and to be able to offer NAEMT education to their students. Deeply appreciate it. Since there have been many changes in the guidelines, we thought we would review them today. We also have some new changes that we'll be talking about. And then you can review them again. They are located on the website in the course administration section. But we thought that we would just take some time to review them with all of you today. First is that when the pandemic broke in the United States in March, our Education Committee took a look at all of our content and made the decision that NAEMT course content that does not require students to practice skills, hands-on skills, can be taught virtually using online platforms like GoToMeeting, Zoom, WebEx, and other types of online platforms. The courses that do have hands-on skills, PHTLS, EPC, Tech, and TCCC, those still do require that the full courses be conducted with the hands-on skills. Those courses can be conducted, the skills portion, using local pandemic guidelines and regulations, or if needed, using video to so that the students can demonstrate the skills portion of the courses. What we have asked our training centers to do is that if they are going to use video to monitor their students practicing and demonstrating skills that they document that in their records. In addition to which, NAEMT also provided an initial 6-month extension for all course provider cards that have expired during the pandemic. The Education Committee will be revisiting this matter towards the end of the year, and if we need to do further extensions, we will certainly be considering it at that time. The committee also looked at testing. So with the pandemic guidelines, testing may be conducted either face-to-face or virtually, provided that course coordinators are able to observe students while they take the test. Face-to-face testing should be conducted following local pandemic guidelines and regulations. Training centers may also use online proctoring services, or they may post their test on their institution's learning management system if it's available to you, provided that the training center protects the copyright of the test. As you know, all NAEMT course material is copyrighted, including our tests, and we ask that our training centers ensure the protection of those tests. So during the pandemic, NAEMT has waived the post-test requirement for certain courses if they're offered live virtually or in a classroom. And that is for all hazards, EMS safety, emergency vehicle operator safety, the EVOS course, the GEMS course, psych trauma, PTEC, or principles of ethics and personal leadership in EMS, our people course. Now, although NAEMT has waived the post-test requirement for these courses, we continue to encourage our training centers whenever possible to offer the post-test because they are a sound method of assessing student comprehension of the course material. But for those other courses, PHTLS, AMLS, EPC, TCCC, and TEC, NAEMT still requires completion of the written post-test. All of these pandemic guidelines, including the guidelines regarding testing and as well as some best practices on how to manage testing in a virtual environment, can be found on our website in the course administration section on the page covering the pandemic guidelines. And if you have any questions about any of these guidelines or questions about how your training center can conduct these courses during the pandemic, please don't hesitate to contact us at education@naemt.org. There have been additional modifications and updates to our faculty policy during the pandemic, and I'd like to also cover those at this time. So during the pandemic, in order to maintain our pool of instructors and make sure that our training centers have the instructors they need, NAEMT is allowing instructor candidates to be monitored by affiliate faculty using video monitoring. And this can be either live or recorded. And all we ask is that the affiliate faculty indicate how they did the monitoring if they were using video on the instructor candidate monitoring form. In addition, NAEMT has permanently relaxed some of the instructor requirements for maintaining instructor status. For AMLS, EPC, PHTLS, TEC, and TCCC, there is still the 1 course per 1 year requirement. However, during the pandemic, at this point, that requirement has been extended by 6 months, and the Education Committee will be revisiting this towards the end of the year, and if we do need to extend it further, we will do so. But right now, there is a 6-month extension. For all other courses, the requirement is 1 course per edition. And course refreshers, hybrid courses, and derivative courses like AMLS Basics, PHTLS for First Responders, Tech Leo, they can count towards that minimum one course. And we also have some policies that are brand new. The Education Committee just approved them. So during the pandemic, NAEMT has extended the time frame for a current provider to complete the instructor requirements. As you may recall, in January, before the pandemic, we made the requirement that a current provider had 12 months to complete the instructor requirements. But given the pandemic, that has now been extended to a 2-year time frame. The committee also looked at the specific unique issues of some countries that teach in languages other than English or Spanish, because those countries hold their NAEMT instructor preparation courses live, you know, in a classroom setting instead of the using the online English and Spanish versions. And some of these countries, particularly the ones that are small, they don't have the turnover or the need to hold instructor courses or bring on new instructors that often. For those countries, the Education Committee is asking those countries if they can submit an alternative plan on how they will complete the instructor requirements for their new instructors, if they need exceptions to our standard policy, and the committee will consider the request of these specific countries. And then also new, to help out our affiliate faculty, our instructor monitoring form and training center monitoring forms are now completely online. So no more scanning and faxing or sending or scanning and emailing. The forms are now fully online to facilitate getting the instructors approved so they can start teaching. And I also want to provide all of our faculty, particularly those who are TCCC faculty, with the latest information on the changes in the TCCC curriculum. Just to go back in 2018, the United States Department of Defense directed all military personnel to complete TCCC training that was prepared by the Joint Trauma System. And the Joint Trauma System is now within the Defense Health Agency in the Department of Defense. The Committee on TCCC, which is now also under JTS and within the Defense Health Agency, this group continues to develop the TCCC guidelines, which are the standards of care for injuries on the battlefield. But the development of the curriculum is now in a separate group within the Joint Trauma System. And as many of you know, there will now be a series of 4 courses as part of the DoD TCCC curriculum. Those 4 courses are TCCC for all service members, and this is for non-medical, non-combatant military personnel. This course is completed, and it is available on deployedmedicine.com. The second in the series, TCCC Combat Lifesaver, has now just been completed, and this is for non-medical combatant personnel, and this replaces the TCCC All Combatants course. A new TCCC Combat Medic Corpsman course is in development, and this will eventually replace the TCCC MP course that our TCCC faculty are currently conducting. And finally, there will be an advanced TCCC Combat Paramedic course that is also in development right now. So we've been notified by JTS that they have transitioned from the All Combatants course to the TCCC Combat Lifesaver course. This is a longer course. It's a comprehensive 40-hour course. U.S. military training centers are now moving to the Combat Lifesaver course, and NAEMT's NATO training centers will be doing the same next month. So all NAEMT training centers, both military and non-military, that are approved to teach TCCC can now register TCCC Combat Lifesaver courses through NAEMT's education portal. After December 31st, NAEMT will no longer be offering the older TCCC AC course. It will be removed from the education portal. And finally, NAEMT has reviewed the content in the TCCC Combat Lifesaver course for possible CAPC credit, and it has been awarded 8 hours of CAPC credit for the Combat Lifesaver course. In terms of instructor requirements, all current NAEMT TCCC instructors are eligible to conduct the new TCCC Combat Lifesaver course. But what each of our instructors will need to do is complete a specialized TCCC Combat Lifesaver Train the Trainer program that can be accessed at deployedmedicine.com. The instructor-student ratio for this course is 1:6. And now I will ask Nancy if we have any questions from our attendees on either curriculum or policy that we can answer for our attendees today.
Thanks, Pam. I just want to remind everyone that we will be taking a few of the questions that have come in for each presentation, and all of the rest of the questions will be answered and the answers posted online. So please don't worry if we don't get to yours. So Pam, one of the questions for you was, where are the online instructor monitoring forms located?
They are located in the education portal, and we will be sure that we send an email out to all of our affiliate faculty with that information, so that you know exactly where they're located.
Okay, thank you. Someone asked if they received a PHTLS ITK, do they get the additional optional lessons, and if so, how? So yes, if you purchased a 9th edition PHTLS instructor toolkit, the optional lessons have been added as they've become available by PSG. So for those of you who had previously downloaded the ITK, just go back into your PSG account, look at the PHTLS ITK, and all of the optional lessons will be available in there. Another question was, will current state certified critical care paramedics be eligible to become instructors for the critical care test prep course, or only IBSC certified? And yes, state certification to be a critical care or flight paramedic, if you are an NAEMT instructor, will count as well. And a question for you, Pam. What are the requirements and length going to be to teach the new TCCC paramedic course, and how long will it last?
So requirements for the 2 higher levels of TCCC will be defined by the Department of Defense, the Joint Trauma System. And as soon as they provide us with that information, we will transmit it to you. You know, they are working very hard on that new curriculum, and they do expect that it will come out sometime in 2021, at which time they will have the instructor requirements available.
Thank you. We have a question about time frame for the release of the community paramedicine curriculum. and we are planning to release the first 3 modules this fall and continue to release the remainder of the standalone courses over the course of 2021 until the entire curriculum has been released. So again, just a reminder that this meeting is being recorded for those of you who are coming late, and we will be answering all questions and posting answers online. But I would now like to turn the podium back over to Rick Ellis.
Thank you, Nancy. It's now my pleasure to introduce Bill Seetharth, the NREMT Executive Director, who will provide you with updates on NREMT certification and recertification and other educational initiatives. Bill, it's all yours, sir.
Thank you, Rick. And I'd like to start by repeating and echoing what was stated earlier, but on behalf of the National Registry of EMTs, certainly we have our admiration, our thoughts and prayers with all of you on the front lines of this pandemic. Those of you on the front lines of the wildfires out west, and certainly most recently those on the front lines either now or soon to be of the hurricane. So you are certainly at risk. We recognize that and we certainly admire that and are grateful for your service to our fellow man. As Rick said, I'm Bill Seetharth, the Executive Director for the National Registry of EMTs, and I want to spend the next 15-20 minutes or so giving you an update from the National Registry's perspective as to things that are happening with us right now in terms of the nation's EMS certification organization, but also to share with you a little bit of history and the last 50 years and then the next 50 years as far as what we're going to be providing as the nation's EMS certification organization. And the reason why I say that is, for those of you that may not know, this year is the National Registry's 50th anniversary. And we had grand plans for a lot to celebrate this year. But unfortunately, there is a thing called a pandemic that we're impacted by. And unfortunately, it is not conducive for a celebratory season nor tone whatsoever. So we are going to be celebrating our 50th anniversary, likely in our 51st or 52nd year, hopefully once we're able to gather. You can advance to the next slide. So as I said, I will be talking a little bit about the celebrating our past and then sharing the vision for tomorrow. And if you can go to the next slide. As I indicated, this is our 50th anniversary, and as I also said, we had many hopes for a very celebratory and event-filled year where we were able to talk at conferences, to certainly have more information, historical, at our booth, and share with people one-on-one. And that's put off for a while. So we're at least grateful for the technology so we can meet many of you, and arguably some we would not have been able to meet if we didn't have this technology. So, but all of this, this year of celebration, and which will continue into next year and perhaps into 2022, is possible through our partnerships with sponsors. And certainly these are many of the sponsors that are listed up here, and we're grateful for their partnership. We're grateful for their sponsorship, and certainly we work together with them to serve the EMS community at large. Next slide, please. So let me start before I really get into the history of the National Registry by giving you an overview of what our mission is. The mission of the nation's EMS certification organization is, if you were to sum it up in a few words, is ultimately to protect the public. And how we do that, as you can see, we do that through providing a uniform process to assess knowledge and skills that are required for competent practice in the EMS profession. And we do that not only at the beginning with our computer-based examination and our skills, or our psychomotor examination, but we do that throughout the career, every 2 years in the recertification and continued competency process. Also, as part of our mission, we maintain a registry or a database of all currently certified and formerly certified EMS professionals from across the country. We are present in every state, as you can see on the drawing on the right, and the number of nationally certified EMS professionals continues to rise, with now over about close to 420,000. This shows 407, but that data are, those numbers are a little bit dated. And we are now approaching about 420,000 certified national EMS providers. Next slide, please. So this is this breaks all rules of PowerPoint here, in that it's an extremely busy slide and has a ton of words on it. I recognize that, but this is a somewhat of a modified handout that we actually have. We are going to be giving out at our booth next year. Plan to give it out this year, but I just wanted to kind of illustrate and give some real high-level highlights, and you can kind of follow along on the drawing on the right versus the reading that you can't read on the left. But as I said, 1970, June 4th, 1970, was officially organized and called to order its first board meeting. But preceding that, as you may or may not know, in 1966, the paper, which is the white paper, famous Accidental Death and Disability, the Neglected Disease of Modern Society, was published by the National Academy of Sciences. Following that, the Johnson administration had a committee under the American Medical Association to look at and study what can be done from an emergency medical services or pre-hospital perspective. The recommendations from that committee was to found or to establish an organization that focused on standardizing and providing some uniformity with the training standards, as well as the competency measurement for ambulance personnel, as we referred to prior to really EMS giving birth as its official name. So the National Registry then was established, as I said, on June 4th, 1970, and has continued throughout the 70s, certainly the 80s and into the 90s, focused primarily on certification and competency measurement, but also on training. The registry has been an active participant in the development of education, curricula, standards, and is partner with others across the industry. In the 2000s, the National Registry became almost exclusively then focused on the certification and the competency measurement, and has continued to stay in that lane. But when we started, there was a bigger amount of effort and focus on education and training. Also in 1975, the National Registry's first executive director, Rocco Mirando, and others established the National Association of EMTs. So NAEMT was founded by the National Registry in 1975, and certainly we've continued to partner and be certainly partnering in sister agencies ever since, and we appreciate that relationship and look forward to growing that relationship in the future. A couple other high-level events that occurred certainly for the National Registry in 2007 is when we started our first computer-based test, which was a transition from a pencil and paper to computer-based test, and we've since then been doing that nonstop. And 3 of our 4 examinations are adaptive tests, which is a different type than a linear test, and it's based on the individual's abilities and competencies. And more recently, certainly we have embraced more technology, and we have started to utilize better ways to assess individuals' competency, as well as we're excited to talk a little bit, and I will in a few slides from now, about continued competency and how we measure competency going forward for someone once they gain initial certification with us. If you can, go ahead and advance to the next slide. So in the midst of our 50th anniversary, as I stated earlier, we had, and this actually is part of our history because several things have occurred this year that have never occurred before in National Registry history. And certainly I'm actually very pleased. I'm quite proud to serve as the executive director and work for it and with a board of directors and work with the staff here in terms of how we were able to modify some processes without compromising our mission to ensure that EMS professionals were able to get certified and maintain certification in the midst of these unprecedented times. a few events that have occurred and certain things that we have done throughout this year to assist in the response to the pandemic include our board's extension of deadlines, which includes eligibility deadlines and recertification for those who were due to expire on March of this year, March 31st of this year. That was extended through June, and I think that was a prudent decision, and we were able to recertify over 125,000 people, which is the highest number we've ever recertified in any season in the National Registry history, ever. So that was a record, and I think that was an appropriate thing to do with respect to that extension. The other extensions for eligibility for taking classes, for taking the exams after completing the class, due to the reality that our testing centers had diminished capacity for social distancing, we had to make sure that we allowed ample time for candidates who were eligible to go ahead and take those examinations. Related, we also stood up remote proctoring, which normally from a testing and a high stakes certification perspective, to turn that on from a testing center where you go to a center and actually take the examination, to being able to take a similar examination from your home on your own computer, would take a testing organization between 9 to 12 months to stand up. We did it in about 6.5 weeks. So that shows the unwavering commitment, the support and the dedication that our staff has here to support the EMS community, as well as the board of directors who had the strategy and the wisdom to say, this is the right thing to do, we need to do this, and let's make sure we put appropriate safeguards in place, which they are, and we're continuing to administer that examination. To this point, as of last week, we had over 14,000 examinations that have been administered via remote proctoring, and that's a testament to the multitude of folks who have supported the notion and who have dedicated it from our board and our staff. And as I said, I'm very proud to be working with the National Registry, especially in these times. We also have partnered with others, certainly the state EMS officials, NAEMT, NEMC, NHTSA, and others, to ensure that we collectively serve the EMS community as one voice as much as possible. From our perspective, one thing that we did do is we worked with NHTSA and the federal government and managed to change some federal guidance documents to recognize testing centers as critical infrastructure and the personnel and staff associated with those testing centers as essential. And what that allowed us to do was open up more testing centers just for EMS personnel as well as nurses. We work closely with the nursing board to do this, and it was in the end, I think, a successful effort and a collaborative effort that shows the power of partnership across organizations serving the EMS community. Next slide, please. So I talked very briefly about our first 50 years, and now I just want to quickly go into our next 50 years. I'm not going to go into all the details, but I do want to talk about two things. One is where we're going from an from an examination perspective, and then secondly, from a continuing education and continuing competency perspective. So I do want to, first of all, start with our examination and give you some insight as to what our new examinations are going to be looking like in the next 3 to 5 years, and then our continued competency and some efforts that are already underway and where we're going to be heading in the next few years. For those of you that saw me give an update last year at the faculty update, I provided similar information, but I'm going to repeat some of it, but also provide you some update as to what we were able to accomplish. Even in the midst of COVID, we've made progress on some of these initiatives. Next slide, please. So the vision of our examinations in terms of where we're going, several things that I will highlight. The first of which I talked about with the remote proctoring. In the upper right-hand side of your slide, you can see OnView, which is Pearson VUE. We use Pearson VUE as our testing vendor. And we were able to, as I said, stand up online proctored exams for EMT and AEMT. and have managed to do so successfully to this date. As I said, administering about 14,000 over 14,000 examinations via remote proctoring. That actually was part of our vision to do and study in 2021 and then implement it in 2022. So we had done some work on this, and our board of directors approved this for an exploration in November of 2019. Little did any of us know that we would have to implement it within a few months due to the nature of COVID and the capacity challenges at the testing networks that we had. So this was part of our future in terms of exploration, especially in the frontier lands where there's challenges with accessibility to testing centers, but we were able to successfully institute this due to COVID nationwide, as I said, at an unprecedented timeline. We're also in the future of our examinations going to be looking more at simulation, and as that pertains to both computer-based simulation for looking at critical thinking and medical decision-making abilities, but also as part of our psychomotor or our skills examination, where we can assess individual skills, opportunities for, like I said, the critical thinking, the IOH station. There are some opportunities where simulation can play as part of this, and technology has since evolved since we implemented the IOH a few years ago. And what we're looking to do is embrace the technology, not only from a simulation perspective, but also the advancements and best practices and better practices in the testing and certification industry. So there will be some changes coming about with the psychomotor examination, some simplification of it, as well as some modification of processes. All of which, though, with respect to our psychomotor examination, these changes will take occurrence over time, and you won't be seeing any radical changes for several years. You will, however, start to see some slight modifications to our psychomotor examination, some bottlenecks and some logistical challenges that have been associated with the psychomotor examination we are addressing, and in the near future you'll be hearing more details about that, but it's more from a logistical and an administrative perspective rather than the subject or content of the examination itself. That aspect, the subject and content of the examination, will be improved probably in about 3 to 5 years from now, is when you'll start to see a more radical adjustment and improvement in our exams. And finally, the portfolio. Right now we have Appendix G for paramedic, and we have a portfolio requirement. And we are working certainly in concert with co-MSP to have ideally one standard for a portfolio and one standard for the Appendix G. So both will meet the same requirement. We do have updated data, which not only are going to help with the portfolio, but also with our examination, our cognitive examination, written exam, computer-based exam, a practice analysis that's published for AEMT and paramedic in 2019. And what a practice analysis is it gives us a snapshot of actually what is going on in the field and what is happening from active participating professionals who are AEMTs and paramedics. And we look at really two critical things there. One is the frequency at which we look at the frequency of skills and types of encounters made by AEMTs and paramedics, but also the criticality. How critical is it that they have that knowledge and skills? So those two aspects are looked at. We do surveys, and we actually looked at NEMSIS data this year, nationwide data, so we could see what the frequency was rather than surveying and getting a memory recall of how many types of encounters and how many times skills are performed. But those data are going in to help us reshape the portfolio. That data is going in to help us update our examinations to make sure that what we test is reflective to what's going on in the field. And that's how we make our examinations, is it's reflective of the profession and the practice, not necessarily the curriculum, not necessarily textbook, but rather reflective of the practice in the field. So that's a high level overview of the exams and where that's going in. Next slide. And this next slide shows what actually was approved by the board last year and some of which I've highlighted as far as some progress that's been made. And I'm going to share with you in the coming slides some evidence of what we've managed to do and how we've been able to do it for the EMS profession. But on the left, you see what the current psychomotor or skills exam is for paramedic, and it breaks it down to the construct domains. And then on the third column over from the left, the assessment format has 3 boxes there: a cognitive exam, which is our computer-based exam, the performance exam, which is in part our psychomotor exam, and then the portfolio. So the 3 elements I talked about there. A couple of highlights that I'll share with you are from the cognitive examination. We'll have what are called technology enhanced items, and I'll show you that in a coming slide. But interactive graphics, that is to give you an example what that's going to be looking like. And we have some of this already underway and developed more from an innovative perspective. But that includes having a monitor and a defibrillator on the computer screen, and using the mouse, they can adjust knobs as appropriate. So we can assess some of the motor aspect, as well as the psycho, the memory, and their cognitive abilities to run a code, for example, via a computer-based simulation that can very well be played through the computer screen that they're taking their computer-based test on. So there is technology, there's innovation that's coming down the pike, and it's not that far away. As I said, probably in the next few years, we will be able to start introducing some of these more advanced or technology and interactive type graphics that will then eliminate the need for the dynamic cardiology station and the static cardiology station. So we'll be able to incorporate that into the computer-based test that is currently given. Performance examination, as I said, you're going to be seeing some modifications to this in the near future, more from an administrative perspective, and a logistical perspective, but more changes are coming in terms of how we're going to administer this. What are some better practices and best practices in the testing and certification industry, and what can we learn from the challenges of the past with this examination, and how can we more precisely measure competency, which better does our mission going forward. And finally, I talked about the portfolio, and the additional item that I'll mention here is we are looking to use the portfolio not only for paramedic, but for AEMT and for EMT. And there are a few states already that are using the portfolio for EMT. So more information to come on that in the near future. But again, I assure you, this is not going to happen overnight. You're not going to find out next week that suddenly EMT has a portfolio requirement. That is a quite at least 2 to 3, maybe even 4 years away till we start really entertaining that in earnest. The bigger focus right now is the paramedic portfolio, from which we'll be able to apply lessons to AEMT and then EMT. So that's the future of our examinations. A lot of exciting stuff. We will be communicating. We will continue to send stuff out, certainly to our stakeholders and our partners, to our program directors, training officers. Many of you are one or both of those roles, our medical directors, and certainly the state officials, to ensure that there is wide and vast communication and full awareness as to upcoming attractions with respect to National Registry. Next slide, please. And this is an example of a technology enhanced item. So it's very simple. Instead of using words to describe a rash, we're actually able to show pictures. This is a simplistic one. This one has actually already been rolled out, and we are using questions of this type in some of our examinations, and you'll be seeing more of them and different types of questions in the coming months. But this is one small aspect that we've been fortunate enough to already roll out, and they are being pre-tested, and we're gathering data on them actually as we speak. Next slide, please. So our examination process, both for reviewing our questions, writing questions, reviewing our scenarios, we couldn't do that without you, and we depend on the participation of subject matter experts such as yourself to do that. So if you're interested, you can go to volunteer.nremt.org. Our examinations, our questions, our scenarios are written by experts such as yourself from the field. We don't sit here at the National Registry and write questions or scenarios. We bring together groups of folks that are representative of the profession that we'll be testing, and you write those questions. We, of course, make sure it's the right format and we're appropriately measuring and asking the questions that we need to, but you are the ones that come up with the content, and we can't do what we do as the nation's EMS certification organization without you. So I encourage you to come volunteer and help us if you can. And we're doing all of our processes virtually now, so it's going quite well. We're quite pleased with it, and we'll be continuing that virtual approach probably for the foreseeable future. But we do look forward to bringing folks to Columbus, though, because that is exciting to have folks here, and we enjoy the partnership with all individuals and professionals throughout the EMS community. Next slide. So the next piece and the final piece that I want to talk about is continued competency. That's the other initiative, and Mark Terry, who's our Chief Certification Officer, is driving this portion of the initiative and for our organization. But continued competency deals with the recertification and how do we ensure that once we measure and determine initial competency, that you continue staying competent throughout your career. Next slide, please. Historically, what we've done since the 70s and the inception of EMS has been that we have a refresher curriculum, and a refresher really is refreshing the content that you've already had since that you already had through your initial training, and making sure you maintain current with content that may have perhaps changed over the last 2 years. That is the traditional model that was associated definitely within the 70s and the 80s. Next slide. We then got into a newer model, or evolved into a newer model of continuing education, which again builds on the premise of refreshing current or old content and content that may have been updated slightly, but continuing education takes on more of a model of lifelong learning, and certainly focuses on education that is perhaps beyond that which you received when you were initially certified. So that was the model that definitely took off in the 90s, and largely is maintaining to this day that we associate with our recertification and our continuing competency model. It is certainly a tradition, not only within EMS, but other professions, to use continuing education to maintain competency throughout the individual's career. Next slide. What we've moved to in the 2012 and beyond has been more of a model of continued competency. And what we're looking to do at the National Registry is to take that continued competency to the next level. And I will say that I think that the efforts we're about to undertake with continued competency are not only efforts that are potentially transformative, but potentially could revolutionize how we look at certification, and certainly how we benefit EMS, because there are ways in which we can better assure competency, perhaps more precisely, as well as without question more efficiently, and perhaps even easier for the EMS professional themselves. How are we going to do this? We're going to be looking at data. That's one aspect of this. As an example, when you fill out an EMS run report, those data are aggregated, and we're able to look at those data from a national perspective. We can start at a national perspective, but in time we can start to look at someone at an individual basis. So the company can be looking at the electronic data to see how many cardiac runs you've had, how many blunt trauma cases you've had, how many pediatrics, how many geriatrics. And then certainly you can use that data to help target where your education should be. As an example, let's say that you have very little geriatric trauma encounters. Maybe your geriatric encounter your education should be heavier focused then on geriatric trauma, because it's a low frequency for you, and it's something that's important to know, but you just have not had over the last 2 years many encounters with that. That will allow you to then take that data and perhaps take courses, for example, GEMS. That would be an appropriate course to help with that. And you'll be able to use that data and your training officers and your education programs to target the education based on the data that are available. It will work with agencies. We will also have assessments. So assessments can be something as simple as answering few questions and or scenarios on your phone every few months that are micro assessments. They're not necessarily high stakes, but you're able to show something current, something relevant to the profession right now, and we can measure your abilities to show that you've demonstrated competency, whether it be in knowledge or in skills. So micro assessments is another option we're looking at. Other innovations as well. Computer-based simulation is one big thing that we'll talk about more in the coming years. We have engaged in some conversations with a couple companies that are doing virtual reality, where there are EMS scenarios that can be administered, and they are pretty powerful. I don't think the technology is 100% yet, but it is going in the right direction, and that is another option where we could be giving credit to that. And finally, we're looking to clarify standards that have been established for continued competency. In other words, what does a medical director need to know when he or she signs off on the paramedic skills saying that he or she is competent? What is the role of the training officer? What role should the training officer play in signing up on skills? Is there a standard that they can go to? So that is another aspect of what we're looking to codify. Next slide. So for the next few years, we're going to be doing several things to help advance continued competency. The first is we've started to lay the foundation. We've had several, last year we had several focus groups. We've had similar conversations this year. We'll have ongoing conversations. The next one is we're using science to drive a lot of this. So we're basing our examination certainly on evidence-based guidelines, but also on research that's certainly out there for continued competency, and we're using that data of evidence-based guidelines for our examinations from a content validity perspective. We are starting to kick off, in fact, it's going to be happening in a couple of weeks, a steering committee, a national group that's coming together of about 30 to 35 individuals to develop the EMS continued competency agenda for the future, a systems approach. It's not just the National Registry that addresses continued competency. It's truly a systems approach. It's everyone in the EMS community that needs to come together to be a part of the solution. We're going to create that agenda for the future for over the next several years. And finally, I talked about it, but we're going to clarify rules for continuing education. We'll talk more about our relationship with specialty search, including IBSC and others that are focused on the specialty certification in addition to core certification. We will take a systems approach with accreditors. So if your agency is accredited, how can that apply towards certification? That it makes sense that if you have an accredited program that requires continued measurement of competency, that we recognize that from a certification perspective. And finally, I talked about this earlier, but we will further clarify the roles for training officers and medical directors. As you can see, this goes on through 2023 until we really pull together all the efforts. This is not something that's going to be done overnight. This is not something that's going to take place in a vacuum. We have some groups already meeting to kick this off, but this is a multi-year process, and it's a systems approach ultimately to redefining continued competency. So next slide, please. I will gladly take any questions you might have at this time.
Bill, thank you for that update, and happy anniversary to NREMT.
Thank you. Thank you.
We look forward to celebrating with you in the future when we can. Due to our time constraints with another presentation meeting coming up in the not too far future, we're going to turn the podium back over to Rick Ellis. And again, I'm going to keep reminding everyone we will be answering all questions online. So Bill will answer the questions that came in for him. So Rick, over to you.
Thank you, Nancy. It's now my pleasure to introduce John Clark, the Executive Director of the International Board of Specialty Certifications, who will provide you with updates on the IBSC certifications. John, it's all yours, sir.
Thanks, Rick. Appreciate that. If I can go to the first slide, please. So I guess it's even numbers help us out, much like the registry's 50th anniversary, Johnny come lately on the block. We are celebrating our 20th anniversary. The first certified flight paramedic exam was offered in 2000. And originally when we started this out, and actually in early collaboration with the registry to try to figure out how to do this, we thought 500 people would take this exam and that's all that would happen. But since then, we've added a portfolio of 5 specialty exams, some other unique exams in the periphery of that, and worldwide have about 10,000 certified flight, critical care, tactical, and community paramedics worldwide. So it's our 20th anniversary. Much like Bill, we have a lot of 20th anniversary swag we were going to give out at meetings that we'll give out next year, I guess. So anyway, next slide, please. You know, organizations, it's all about relationships and who we know and who we talk with, et cetera. And that is one of the impacts of COVID. But in the middle of all of this, for any of you that have known Jeanette Myers, Jeanette's been with the IBSC since 2012, and she has been our registration coordinator. She is moving on to other things, is moving across the country, and it allowed us an opportunity to hire a new registration coordinator, and it's really our first change in personnel since, you know, in the last eight years. So when you call the office and you hear the voice on the end, it will now be Ashley Roy. Ashley joined us. She's in training right now. Jeanette's last day is actually coming up on the 22nd, but so you'll have a new voice in the office, and I just wanted to share that out there for everybody that's calling. Don't be confused that Jeanette's not there. It's now Ashley, but she'll take care of you in the same way that Jeanette has. Next slide. So with COVID, it was an incredibly interesting thing for us from a testing perspective, because as things developed so quickly, we received a phone call from our psychometric vendor and a test delivery vendor in the middle of March that said, oh, we're closing 100% of our test centers effective tomorrow morning. And we ground completely to a halt. Any paper pencil exams that we had, on-site exams that we had scheduled, also needed to grind to a halt because Prometric was not going to be able to grade them. And then working with Prometric, and I know Bill did some of the same things with registry, is that we were able to deem that our exams were considered essential workforce, much like, you know, paramedic and some of the nursing things, et cetera. So we were able to start to pick up with our testing. And they started to open test sites in specifically targeted areas so that we could continue some of our testing. We still struggle with that. Test centers are at a much reduced rate, and I know that that's been a frustration for a lot of our candidates that can't get the testing dates exactly they want, and there has to be a little more flexibility. But the impact that has been on us, next slide, as we ground to a complete halt in March, April, our testing volume was 77% off of what it was same time last year. But then, as you can see, we grew as testing centers started to open more worldwide, and then started to add capacity. Then we're back, and then last month we were actually 21% above where we were last year. Not surprising. If you look at the percentages of people that were unable to test, they were trying to play catch up to get in there. So that's good for us if you are having problems getting people scheduled, especially with some of the new discounts from NAEMT that we're offering. You know, the volume is there. If you have any questions, certainly reach out to us. We'll see what we can do. Next slide, please. So in this time, it's interesting, you'd think, and at least from our perspective, as we weather COVID, that we'd just be sitting around trying to figure out what to do next. Well, this has actually been probably one of our most productive work times, and we've added a lot of new things and continued projects in the background. One of the things that we did with testing, and as Bill covered earlier, with same as the registry, we had talked about remote proctoring, remote live proctoring as an option. And with our accreditation through the NCCA, they were not fans of proctoring remotely. And because of the pandemic, it allowed us to go ahead and explore that. We requested a waiver and was granted from the NCCA for a 60-day window to try remote proctoring, compare it against our regular CBT testing, and we have to provide them data back to see what it looks like. But our ProProctor went live July 2nd, so that gives us a new delivery method as well, so you can take all the IBSC exams from the comfort of your own living room. Another project that we're working on, happy to announce that we've signed a contract and are working with the National Association of Public Safety Infection Control Officers to develop their Certified Designated Infection Control Officer, their DICO exam. That's in process right now. with a beta test looking to happen in November. Again, those numbers move a little bit. It was supposed to be launched with the Virginia EMS conference as a beta test site, but with cancellation of that conference, we're looking to see where we're going to go with that. But that's an exciting new project for us. We just updated the CPC exam, the community paramedic exam. The biggest change in that blueprint was that there were 4 domain areas in the original exam. That's been expanded to 6. And the real structure of that change was that the patient-centric care section was very, very large. The new SME group that met to do this JA and then the survey results that came back in, we ended up carving that up into 2 different pieces. So there's a patient-centric piece that is truly about patient care, but they divided off into a section about caregiver education, family members, some things to look at there, as well as some wellness concerns for the community paramedic. And then also, because of the autonomous practice that most community paramedic mobile integrated health kind of settings allow, they felt that there needed to be something more on ethics and medical legal. So we've added a 6th domain area to cover that. So the beta test went very, very well. And all the scoring went out on September 4th, and the new exam is now out and live. With the FPC beta, we're doing the same thing. The revision, actually, Trent Dobbs, from a representative from NAEMT, joined us for our SME group, and we revised that survey as we do every 5 years for every exam, and that process is ongoing right now, ends in November. And then the next exam that we'll review is our critical care paramedic, which is scheduled for October. And as of now, we plan on doing that live in Baltimore at Prometrics facilities, but we'll see what happens. And the most interesting thing that ground to a complete halt, it was totally ready to launch in March, and then this all happened, is that we have transitioned nearly 99% of the way away from pencil paper exams. We've changed to what we call IBSC Med, which is mobile exam delivery. And essentially in these remote settings, a lot of Department of Defense settings where they're trying to get a lot of soldiers through in a very, very tight time frame, or very, very remote settings where there's not a good opportunity, as well as conferences. This meeting would have been, or EMS Expo would have been one where we would have used IBSC Med. We've switched to a laptop-driven testing environment. So in the conference room, you'll come in, sit down with a laptop, get immediate scoring, and that's called IBSC Med. So that's what we're looking at as far as projects going on right now. Next slide, please. I put this in for you as faculty, just from a question and answer perspective. One of the things that is always asked about is we get a lot of calls into the office about, well, I missed by 1 point. Well, that's not entirely true, because you actually missed by 37 points. And trying to explain that. But so on the exams, traditionally we've had 125 scored items on the exam out of 135 items with 10 pilot items. In order to bolster our banks and just from the item writing perspective, and also some new recommendations that potentially are coming down from the NCCA, is they would like us to have 2.5 times of the live items in our item bank. So we are looking to improve that number. So our exams are transitioning from 125 scored items to 110, but maintaining the same validity of the original scoring system. So you'll see how that changes a little bit, and where the raw pass scores are in there, and just gives you an idea of what people are looking at as far as the raw number to pass the exam. Next one. And this I wanted to put in, we had a little discussion offline about this, and I just thought this was interesting for you to think about what's going on in the workforce in general, and where certification lies, and especially specialty certification. Every year we do this, our lab certificates. We had 600 people that failed to renew in 2019 over the 4-year cycle. 100 of them bounced. And the interesting thing about the bounced emails, the majority of those were company emails. And so what that tells us is that the reason the email bounced is they left the industry or they went to a different job and didn't update their results. But next slide. And I thought this gives you some idea of what we're seeing, and when we think about everything from the specialty classes, specialty certification, to even retention in your own organization, is that 19 of those folks that responded out of the 114 responses were it's no longer required for their position, which meant there was a transition internally. 15 left EMS entirely. And then I thought it was interesting, the number of people that went to medical school or left for nursing were much greater than the people who retired. So I just thought it was an interesting slide to put in there to kind of give you an idea, just in our small subset of people, of why they're choosing not to recertify their specialty certification. And next one, and ties into this, this was just, I felt very interesting from our perspective. This is different probably than what you might expect, is that the large majority of folks have a lot of years in EMS. And so that's just, these are the specialty certification folks are seasoned people that have been there for a long time and have been doing the job for a long time. And so potentially, targeting that education and looking at how they are, it's not the guy that's been in for less than 4 years. It's the people who've been there for 20 or more years. Next slide, please. And it's just my own selfless plug to put out there, is that please follow us on social media, as we recruit item writers and SMEs and everything from that. So if you're interested, checking into any of those social media platforms, you'll get some of the latest updates to join us on some of our volunteer projects and just to see what's going on. So that's all I have, and I appreciate the time for being able to address you. And in the same format, I'll address any questions later.
Thank you, John, for that update. It sounds like IBSC has a lot of new exciting projects in the works, and we certainly look forward to getting more of that swag that you talked about. We all appreciate what IBSC has to offer. Rick, I'm going to turn the platform back over to you.
Thank you, Nancy. It's now my pleasure to introduce Michael Caduce, EMT Program Director, UCLA Center for Pre-Hospital Care. Michael and his team at UCLA are maximizing the potential of virtual platforms to engage students taking the NAEMT courses. And Michael will share his strategies with you today. Welcome, Michael.
Thanks, Rick. I appreciate the opportunity. Next slide, please. I think one of the things that this pandemic has taught us, and one of the things that we've always known, is that education for healthcare providers has to continue. We have to continue educating the doctors, nurses, EMTs, paramedics, the frontline providers who are out there ensuring that we make it through this pandemic. In fact, JAMA published in their last edition a perspective saying the exact same thing. I actually pulled a sentence out of there, which I thought really hit home for all of the educators and all of the providers that are out there. While many of us remember the COVID-19 pandemic as a source of disruption, it is likely that it will also be viewed as a catalyst for the transformation of medical education that has been brewing over the past decade. And I really think this sums up a lot of what we've had to do in the last 6 months. If we're doing hybrid education, online education, flipped education, these are all things that have been out there for the last decade. The COVID pandemic really just made us speed up our transition to some of those courses. I want to share with you today some of the ways we've done lectures, activities, skills, and scenarios during the pandemic to kind of show you that it's not impossible. It doesn't take a ton of extra technology, but you can do it. So I'm going to take some examples from some of the courses that we've been doing from the NAEMT and some of our initial education courses, show you some pictures of some of the things that we've done and the results that we've gotten from those students. Next slide, please. This is me. I'm taking some selfies here, but I thought it was a great example of our airway lecture. So I was doing an airway lecture here, and so I'd set up, I just went into the classroom, plugged my computer into a big screen TV that we already had hung on the wall, and put my Zoom up on there. What that allowed me to do for delivering my lecture content was be able to see all of the students. They're on a break now, so all you can see is their cameras that are turned off. But when their cameras are on and I put them on this big screen, or if we plug it into a projector, you can actually get some of the same engagement that you would if you were in the classroom. You can see the students' engagement, you can see the looks on their faces, you can tell if they're starting to yawn, which means it's time to transition to a break. You can see all of those things. I was lecturing behind my laptop, which you see there in the graphic, and so the students could see me. But then when I wanted to demonstrate an airway technique, maybe just raising the head of the bed or direct laryngoscopy, I actually had another camera that was situated right next to the mannequin, about a foot from the mannequin's face, so that students could see all of what was going on. So even while doing lectures, we could still make it interactive. We could still engage the students, and Zoom allows you to switch between cameras. So I would just switch to the camera I wanted, demonstrate what I wanted, and then I could easily go back to lecturing while still engaging with my students so that I could see what their perspectives were if they were engaged. They all kind of had that puzzled look on it, time to circle back. And of course, if you've ever been in a classroom with me, you know that I usually need a little bit of energy. So the Monster energy drink made an appearance there in my whole online setup in one of our classrooms. Next slide, please. This is another setup that we've been using for a lot of our online lectures. Since we've all moved to our houses to deliver all of our content, we've got pretty creative in how we've delivered it. You can see this is actually a picture I took while we were doing a webinar. So you can see on one screen, I've got the webinar going with the chat. I've got the agenda pulled up, and then I actually have my home computer set up right next to it. And one of the innovations that we've discovered is setting up a group chat of your instructors while your session's going on, whether it's a webinar, NAEMT course, is incredibly helpful. If you need to send an announcement out, hey, we're 10 minutes behind, we're 10 minutes ahead, we're gonna take a break, hey, remember you're up next, are you ready? Do you have everything set up, ready to go? We found that was pretty helpful and quite innovative. So you can see I've got WhatsApp open and iMessage there. So just a way for us to communicate as instructors without having to broadcast messages across to students. It allows the end user, our student, to get just a much better product. So whether it's PHLS or AMLS or GEMS, we can have this instructor setup already going so that you don't have to try and transition everything online. It's really not as hard as it looks. We did find that there's a couple accessories that were incredibly helpful. Certainly all of our computers have built-in microphones, but we've purchased all of our staff a little bit more professional microphone. Just makes it much more crisp and clear, especially when we're starting to kind of get all of our medical terminology words put in there. Having a microphone that picks you up much better is helpful. We've also got all kinds of lighting for some of our skills. You'll see, you see my oxygen cylinder there, or my makeshift oxygen cylinder there, which will make an appearance here shortly. We've wanted to get some lighting so that students could actually see what was going on. They weren't seeing things in shadow. We found that some good lighting was actually also really helpful. So a couple innovations that we've discovered by just doing some of our classes. Next slide, please. That was how you can do lecture at home, but what we found is that doing some of the classroom activities is easy to move online as well. Here you see one of the EMS safety activities for vehicle blocking and apparatus placement. Quite easy to transition online. I just got some of my friends from LA and some of my friends from Iowa on a Zoom session. I wanted to test this to make sure it worked, and we've since recorded it and put it up on the NAEMT site as well. I actually went to just Google Images or Google Maps and picked out some intersections in my community, copied them out, put them in PowerPoint, and then copied out some vehicle apparatus so that you can just move them throughout the PowerPoint. So very easily just click and drag the LAPD cruiser or the LAFD fire engine, put them where you want them. We've got some traffic cones. I got my start at Urbandale Fire, so of course that was the ambulance I had to use in this activity. But it allowed us to really demonstrate the key educational principles here of putting your vehicles in the right place, where you would park everything, ensuring that you have safe operational scenes that we would have gotten in any traditional EMS safety class. Next slide, please. You can see here we did the same thing, got a little bit more creative and just changed the roadway up a little bit. So instead of getting just a Google Street View or just a Google Map view, we just took a Google Street View, which you can do, set up our accident scene there, and then again, extrapolated the principles, made sure we took an extra lane of traffic, make sure we had blocking with cones and police vehicles out front of our scene, and quite easily could transition this activity online. Didn't take a ton of work, and our students were happy to engage. As the instructor, you can move the vehicles where they want them, or you can actually let them take over your screen and drag and drop the vehicles where they want. Led to some great discussion. We had one that had a railway incident in it. So great opportunities for our students to engage, have that discussion that we would expect them to have in any brick and mortar classroom as well. So that's how you can do some of the activities that come with EMS, the NAEMT courses. We actually did a GEMS class on Monday. We had a full course, which was excellent to see. We did our lectures during the day and then gave the students the activities over lunch. So I put up a slide over lunch that just said, hey, here are some of the activities we normally do. Maybe it's wearing leather gloves to simulate reduction in dexterity. Maybe it's putting some small Post-it notes over the lenses of glasses to simulate macular degeneration. We made the students then prepare their lunch that way. And then at the end of lunch, we brought everybody back and had some great discussions and explanations and how difficult it was to use their non-dominant hand to prepare their lunch, or that they may have spilled some things at lunch, really to hit home that empathy that comes with caring for some of our geriatric patients and the processes of aging. So even though we're not in a classroom, we still gave the students the activities, got great participation for students. They really got to live through the tasks and just doing stuff they were normally doing, gave them some opportunities to do that. And they really took it to heart, and we had some great discussion over the empathy that we have for our geriatric patient population due to some of these changes with aging. Next slide, please. We also can do skills online, and you see here a great example of my homemade oxygen cylinder. We moved all of our skills labs online in March. We took all of our initial education courses and quickly had to transfer them online and then start new classes online with the hope that we could bring students back. This applies to all of our NAEMT programming that has skill stations like the basic assessment station for PHTLS, the tourniqueting station for PHTLS as well. You see my makeshift tourniquet there with a butter knife and a couple of t-shirts. We literally told students, go find whatever you have throughout your house to come make a tourniquet. I was amazed at the number of people that could find scarves and tore up some t-shirts, and we're doing some tourniquets on table legs, chair legs. This is my stand-up fan. It wasn't super complicated to make this work. Wooden spoons make a great win list and seem to be the most popular item people could find around their kitchen for tourniquet application. You see the same thing here with my oxygen cylinder. This is a shipping container and a paper towel roll. I just printed off some pictures and put them on there, found a bottle cap that fit inside the paper towel roll so you could actually adjust the regulator and the flow, and then put a bolt through the middle so that you could actually attach your regulator to your oxygen cylinder. I had some spare shoelaces in a drawer. Those quickly became nasal cannula, and with attached to a binder clip, you could very easily snug it up under your chin. I was amazed. We did not tell students to go do this and that they could make their own to do this, but they did anyway. They took it to heart and really practiced some of these skills. I think that extrapolates very easily to our NAEMT programming, where we set the stage for our students and said, this is going to be an interactive class. Even though it's virtually, you're going to have to be engaged. And our students took it to heart with some really cool oxygen cylinders made out of water bottles, even to the point of like they found a way to get the O-ring from the oxygen cylinder to fit into the water bottle so that they actually learned the steps in the skill. Now, it's not just our opportunity to get our students to be creative at home. There is science, there is learning that takes place here. What we know from the science is that if we can extrapolate that concept of the tourniquet, of the oxygen delivery device, all of a sudden when students are brought back to class and they can do these things and we give them the tourniquet, they understand what the win list does. They understand how the tourniquet should be applied, and they don't need a review of that. Here's step 1. Here's step 2, here's step 3. They already have the conceptual knowledge because they've been able to practice it on the things they have at home, and they're able to transition it very easily to the classroom. So we saw some students getting immobilized to ironing boards. We saw some makeshift non-rebreather masks, just really creative things that our students could do at home that very easily can get them engaged and interactive, and they don't just feel like they're sitting there being lectured at all day. Next slide, please. We can even take that one step further and start doing some scenarios in the classroom as well. What we would normally do in the classroom, we've taken virtual. You can see here a group of students, they were just practicing the basic trauma assessment as part of PHTLS, and this gentleman's roommate volunteered to be his patient and even got more creative than we wanted by giving a whole scene and actually having some injury patterns. So quickly took us to the next level, but I was amazed at the number of family members, friends that wanted to get involved, roommates, the people that our students were socially isolating with. I'm amazed at the number of fathers and mothers that want to be involved in their kids' EMT education. Same thing with brothers and sisters. I think that not only are you doing a trauma assessment on your dad or mom, that takes it to a whole new level in terms of having to deliver good therapeutic communication and explain to your patient what you're doing. So again, we didn't tell students they had to do this. Their roommates were volunteering. We didn't say, go find somebody, you have to bring someone to class today, to our virtual classroom. They just had people that wanted to get involved and wanted to know what they were doing, and we were able to do it. We did some other cool things. Again, we tracked all of these skills, so the people in the Zoom session are also tracking skills. So we were able to do all of that online in the virtual environment. Next slide. Our students took this really to the extreme. This student set up a whole setup in his driveway for a trauma scenario. Again, we didn't tell the students, yeah, go set something up in your driveway. They took it on themselves to do this so that they could make the classes interactive and as realistic as possible. So this is this son's child who crashed his bicycle in the middle of the driveway, did his trauma assessment. We were able to do all of this through Zoom. And then he actually had a partner on scene that was on the Zoom classroom with us. And so he asked his partner to get vital signs. So through the private chat feature of Zoom, we sent that person the vital signs. So they were actually engaging as two EMTs or paramedics providing care for each other. He insert this vital signs. Oh, what'd you get for the blood pressure? What'd you get for the heart rate? They were able to actually engage and do that. Again, those learning principles that we depend on in the classroom are able to extrapolate here to our virtual environment as well. So really great to see our students willing to do this, willing to have the creativity to do it and take it home, but also to know that, yeah, there's some learning going on here as well. Next slide, please. If you can't take your class online and you can't get the students necessarily to go out into their driveway and do skills labs, you can still do some great case studies. And we see this across the board in all of our NAEMT programming. There's great case studies in there. You can get creative. We've added some graphics to some of our scenarios. We also have iSimulates reality, so we can actually take what a cardiac monitor should look like and embed it into our slides so the students actually can see what's going on. And to the point of the students can actually start annotating on the screen and pushing the buttons that they want. Changing whatever they want to make in this slide. So really a cool feature there. But even if you don't have those features, you can Google pretty much any 12 lead you want. You can Google the scenarios. We'd set up virtual backgrounds where, it's a fall patient from PHS. So we set up a virtual background that looked like a similar incident, a 3-story fall from a deck. That's pretty easy to come up with on Google Images. Motor vehicle collisions, we set those up as virtual backgrounds so that students could actually see what was going on. I actually had an ambulance as my virtual background, so once the students said they were en route, I just switched my virtual background to the back of an ambulance as just a good reminder, hey, this is where we're at, kind of sets the stage for what we're doing and really engages our students to that next level of learning so they don't feel like they're just being lectured at. So you can do lectures online, you can do skills online, you can do scenarios online and case studies online. The last thing I would say, next slide please, is you have to prepare your team for this. You have to prepare your staff to engage and to be ready to go online. I am self-isolating here at my house with nobody, so I got all the animals I could find and all the tech I could find and set it up and did a demonstration for our staff on how you can teach patient assessment via Zoom. You can see the virtual background has our primary assessment flowchart in it, ABCs. So when the students are practicing it, when I'm talking about it, they don't have to be staring at the screen. They can just be looking at the background and they don't have to switch between screens. So I put this together with 2 interactive students. They were less interactive than some of the other students we've had recently, but we were able to engage our students, really do some training for our staff to show that you can do this. It is possible. We actually do dry runs for almost all of the online courses that we're doing. Very important, in March, we did 2 dry runs before we ever did a skill station. Come to find out, on the first dry run, the platform we were going to use couldn't withstand the bandwidth that we were going to put through it with the number of videos we would have actively going. So we had to quickly transition to a different platform. Great that we were able to do that, and it wasn't the morning of being like, oh, we have 14, 15, 30 students on and we can't make the tech work. So doing a little bit of training with your staff. We've since taught almost all of our instructors how to go online, how to teach online, with the fear that we were very very concerned in March and April that we were going to have to kind of clamp back down, bring everybody back online. We haven't quite seen that play out, but we still want our educators to have the knowledge on how they can do a skill station online. These again are our clinical instructors who are typically in the classroom with the students doing skills, but since we couldn't or we can't, we may not be able to, we don't really know. So we've been trying to train everybody up so they have that ability to do it. So making sure that everybody is trained up to teach online. So you can do this at home. You can do virtual classrooms. We've seen it working through our initial education programs. We've seen it working through our NAEMT courses. We can continue to educate providers. We have to continue to innovate. We cannot just sit and go a year without educating our providers. I'm open to questions, or if we're going to delay that for later, I'll totally get back to people as well.
Thank you, Michael. Thank you for sharing all of that information with our faculty, and thank you for the innovations that you and your team have developed. We really appreciate it. I do want to throw out one question back to Bill, actually. Bill, one of our faculty members is wondering if there's a timeline for the NCCP revision.
There is going to be some modifications next year in terms of this year for the research season starting in October, 2 weeks away, through March 31st of 2021. There aren't any substantive revisions. The simplification of the application that we did this past cycle for 2020 will continue into 2021, but we don't have any substantive revisions coming up this following year.
Okay. And are there any updates on international NREMT programs?
I don't have any specific updates other than the board has approved a program in Israel. I'm drawing a blank with the name recently at our meeting, but we don't really have any substantial updates. There's really not been any focus internationally. We've primarily been focused domestically, but there was one program in Israel that was approved. Most of those students that are there are actually U.S. citizens, and then they come back to the States and they're trained over there to the U.S. standards, and then come back nationally certified, and then are able to certainly function in the States. But aside from that, there's really there's no other substantive update.
Thank you. One more question for you.
Sure.
When you mention working with accreditors, will this include agencies that have CAAS and/or CAPC accreditation?
Yes. Yes, that's what we're talking about. So CAS accreditation is one of the groups that we would be looking at, because they have standards that are required, that they're required to maintain with their employees. So if they're ensuring competency and doing QA checks and looking at records and required to do analysis after certain calls and debriefings after certain calls, that all is in the spirit of certainly continuing education, but continuing competency as well. So those are some of the solutions we're looking at, and I don't want to say it's definitive, but certainly that's on the landscape, and it's consistent with what others are doing in the certification industry. And we're open to having the dialogue and conversation through the steering committee to explore these options. But that is definitely one.
Okay, great. Thank you. Pam, there's a question for you. Are trauma lanes being made mandatory for TCCC MP and actually written into the curriculum and not left to be optional?
And I will be honest with you, I do not have the answer to that question, but I think it's most important that we direct that to the people over at the Department of Defense within the Defense Health Agency that are developing the curriculum. And we're happy to take that question and get it answered, along with any of the other questions that we're not able to get to today. And we will post the answers to these questions up on the website, and then send a link out to our faculty so that we can get you those answers.
Great, thank you. Michael, if I could pose this question to you, what online tools do you recommend for exam proctoring?
Great question. There's a few different online proctoring services that are out there. Certainly, we use one of them at UCLA, but not to be brand loyal, there are several of them. We've invested some time and effort into evaluating all of them. Depending on the level of security that you want, if it has to be 100% proctored, kind of like what Bill talked about, their Pearson Views online system is pretty secure. So is some of the online proctoring services. I would say a lot of learning management systems also allow some exam creation and delivery. So if you're not so worried about your items, or you can have them less secure, then that's certainly an option. I know some of the open note and open book tests and things like that by the American Heart Association are a good starting point in terms of letting students, what used to be a very secure exam may be a less secure exam now. That's more of the initial education providers, I would say, for like PHLS and AMLS. You can do this through Zoom, and some of the learning management systems will allow you to open an exam, will block all other JavaScript that's running, so all other websites and things like that. So I would say definitely look at your learning management system first. They may have some opportunities for you, but then there are some online proctoring services that cost the students a nominal fee to test as well.
Great, thank you. Bill, another one for you. What about low volume rural services in terms of the future planned system for NREMT?
Yeah, so that is a couple points here. I'm assuming in terms of access to tests, and really we're talking about frontier land and some areas like Wyoming, Montana, Alaska. So that actually was the driving force for us to look into remote proctoring in the first place. That's why, as I said, in November 2019, our board approved the ability for us to explore remote proctoring, especially in frontier lands and very remote, difficult to access areas. And that's what we were going to be looking at in next year, and then implementing potentially in certain areas in 2022. So that's what we're hoping to do with remote proctoring once we get back on our feet in terms of reassessing how we can deploy or update or upgrade the remote proctoring features based on the lessons we've learned the last 5 or 6 months that we've been doing it. So that is the focus.
Great, thank you.
Sure.
I think the person who was asking about the rural communities was asking about the individual recertification requirements.
Okay, so for the upcoming research season, which starts October 1 of this year through March 31 of 2021, the board has issued a waiver on the distributed education limits. So distributed education can be used to achieve all the requirements of education that previously were required to, had limits on them in terms of how much could be done via distributed education. And as I go back to what Pam stated earlier in terms of what NAEMT is doing, is with the class options that are available, there's even more that's going to be available now, which provides greater access to candidates and students. And our board is supportive of that, but also recognize that the following research season, which starts October 1, 2021, which is next year, not this year, but next year, through March 31, 2022, we'll go back to the waivers that have been historically imposed on how much education can be achieved via distributed education.
Great, thank you.
Sure.
All right, we look forward to answering all the rest of the questions online, and thank you everyone for sending in questions for each of our speakers. We really appreciate that. I'm going to turn the podium back over to Rick again.
Thank you, Nancy. It's time now for some recognitions and honors. Each year, NAEMT recognizes a few of our tremendous faculty who have made outstanding contributions to the development and promulgation of NAEMT education. I'm very pleased to present this year's NAEMT Education Service Award recipients. Our first recipient is Sergeant John Walden, who serves as an NAEMT affiliate faculty at the Defense Medical Readiness Training Institute, or DMRTI, in San Antonio. For over a decade, Sergeant Walden has been a champion of NAEMT education within the United States and international military institutions. He has been a valuable resource to NAEMT by assisting new training centers and faculty, and in providing his extensive expertise as a CAPC reviewer for our courses. Congratulations and thank you, Sergeant Walden. Our next recipient is Kathy Cockrell, NAEMT Education Coordinator for the state of Virginia. Kathy has been involved with NAEMT education for more than 20 years. She has promoted all NAEMT courses within her state and has assisted with mentoring of new instructor candidates and new training centers. She has been a great resource to NAEMT on changes in her state's EMS educational requirements. Kathy, we truly appreciate your service. Congratulations on your award. I am pleased to present our next award recipient, Amanda Ukupul, an affiliate faculty from Mexico and a member of the Latin American Regional Education Committee. Amanda worked with committee chair Elkin Fuentes to help launch NAEMT virtual courses. She has actively participated as both an instructor and an affiliate faculty in many NAEMT virtual courses. Since becoming an affiliate faculty in early 2019, Amanda has helped launch over 20 training centers in Mexico and other Latin American countries. Amanda, thank you for your commitment to NAEMT education. I am pleased to present an NAEMT Education Service Award to Ahed Al-Najjar from the United Arab Emirates. Ahed is an EMS director for the National Ambulance in Abu Dhabi. Ahed brought the Emergency Vehicle Operations Safety, or EVOS, course to the United Arab Emirates and has reinvigorated the NAEMT Training Center at National Ambulance. He is a PHTLS and EVOS affiliate faculty and serves as an instructor for 6 other NAEMT courses. Through his efforts, all of the United Arab Emirates emergency responders will be required to complete EVOS course as a job requirement. Congratulations, Ahed. And we would also be remiss, we'd like to thank Ahmed Al-Hajari, the CEO of National Ambulance, for his support in bringing EVOS to the United Arab Emirates Ministry as part of the doctor's program. Our final recipient for this year's NAEMT Education Service Award is David Trent Dobbs. Trent is a flight paramedic with Air Evac out of Portland, Tennessee. He teaches many NAEMT courses and serves as affiliate faculty for PHTLS and AMLS. Trent is also one of our critical care test prep authors and taught the inaugural course on Monday and Tuesday. He recently represented NAEMT on the Unplanned Extubation Awareness and Prevention Initiative and on the IBSC Flight Paramedic Job Analysis Survey Work Group. Congratulations, Trent, on this well-deserved award. So as we conclude our meeting, I would like to again thank both the Public Safety Group and GEMS for sponsoring today's meeting. Thank you. And on behalf of NAEMT, please accept our deepest thanks and appreciation to each and every one of our great faculty. Thank you for all that you do for our EMS students and the patients that they serve. We hope you, your families, and your colleagues remain healthy and safe.